Hello everyone. Today we are demonstrating the insertion of the LMA Supreme, which is a second generation supraglottic airway device designed for optimal ventilation and gastric protection. As you can see here, before insertion, we check the LMA cuff for any leak by fully deflating it with a syringe and also inflating it to see if the cuff gets inflated well. Now this LMA looks absolutely fine. Now we will be taking water soluble jelly, which has two uses over here. First is to lubricate the posterior surface of the LMA for smooth placement, and second is to perform the jelly test, which you will see ahead. In the jelly test, we place a drop of jelly in the gastric drainage tube of the LMA and observe the movement of the jelly. Now we position the patient in a sniffing position for optimal alignment. Open the mouth and hold the Supreme LMA like a pen with the black line facing the upper lip. Using a single smooth motion, advance the LMA along the hard palate until you feel resistance. Do not use any force. Now you will see we are performing the jelly test, in which we place a little bit of jelly along the proximal end of the gastric drainage tube. If the jelly is sucked inside the tube, that means the tip of the LMA is correctly positioned in the upper esophageal inlet. You have to inflate the LMA with the recommended air volume and make sure that the LMA has a good seal without overinflation. We can confirm the correct placement of the LMA by attaching the circuit, ventilating the patient, and assessing for three things: chest rise, auscultating for breath sounds, and checking for capnography. Finally, secure the LMA with tape or a fixation device. Thank you.